I'm Cindy Sandercock, a registered nurse, bargaining unit president of the ONA Local 105 at Northumberland Hills Hospital. With me is Ann Clark, ONA's vice president for Region 2, which is the eastern part of the province. ONA Local 105 represents 190 nurses at Northumberland Hills Hospital in Cobourg. The hospital serves the catchment area of West Northumberland County, a mixed urban and rural population of approximately 60,000 residents. West Northumberland comprises the town of Cobourg, municipality of Port Hope, and the townships of Hamilton, Crammy, and Haldeman. NHH is located in the Central East Local Health Integration Network, the LIN. The Northumberland Hills Hospital currently provides care to the community in the following areas: an emergency department, a six-bed intensive care unit, 62 acute care beds, provides surgical services, 7 complex continuing care beds, 11 interim long-term care beds, and 18 inpatient rehab beds, 6 palliative care beds, a total of 110 beds. The hospital serves the surrounding community, and the next location to access specific care like emergency services is approximately 30 minutes or more away. Today I want to talk to you about the cuts to patient care that we will be facing at Northumberland Hills Hospital. It is important to note that every nursing position that is cut, it means a reduction of 1,950 hours of patient care is being eliminated. The planned nursing cuts amount to the total of 11 full-time nursing jobs and 9 part-time. We are also losing some probationary nurses in these cuts. So the total is larger than the 10 full-time equivalents that we were told that the budget allowed for. So that is a total of, my original numbers were 20,000 hours of nursing care, but it is much larger than that. It's probably closer to 30,000. Cuts to balance the hospital budgets have forced the elimination of nursing positions in our communities, which affects patient care. Each RN is required to provide more care to patients because of these cuts, which is taking a toll on the health of our nursing workforce and the safety of our patients. Closing clinical services in small hospitals and closing outpatient clinics does not improve patient care when patients are forced to travel distances to access this care. This is especially problematic for emergency care, as we've seen in other communities, but also has far-reaching implications in so many other areas. In our community, the current fiscal plan sets out a plan that will close 26 alternative level of care beds, which the average length of stay is 10 to 150 days or more. Those patients mostly waiting for long-term care beds in the community. Of note, 12 of those 26 beds currently are ALC cohort beds located on an acute care floor, which at any one time can be an acute care bed. Additionally, they are cutting 4 beds on that unit, which are 4 acute care beds, a total of 16 beds from an acute care floor. If this fiscal plan goes forward, the community should be aware of the fact that balancing this budget by cutting staff and beds as planned does not take into account processes will not be in place for the reallocation of these patients, let alone future alternative level of care patients. These and any additional ALC patients will very quickly occupy most, if not all, of the acute care beds, leading to longer emergency waits and acutely ill patients being cared for in the hallways of our emergency departments. Fast Track is also being integrated into our emergency department, which will increase wait times. Additional cuts to services include immediate closure of our in- and outpatient diabetes education, and these services are not available in our community. The immediate closure of our outpatient rehabilitation clinic will also be devastating to our community, as it is the only OHIP-funded clinic in our community. While there are some private clinics in our community, there are many members of our community who will not have access due to socioeconomic reasons. And the nearest OHIP-funded clinics are in Oshawa and Peterborough. This plan is transferring public health care to private clinics where the public has to pay out of pocket. Inadequate nursing staffing directly impacts patient outcomes. One added patient to a nurse's average caseload in an acute care hospital is associated with a 7% increase in failure to rescue or complications, a 7% increase in patient mortality, and a 23% increase in nurse burnout, and 15% increase in job dissatisfaction. Hospitals and their consultants claim that cuts to nursing hours will not have an impact on patient care, but we know the research evidence that this is not the case. Yet Northumberland Hills is ignoring the research, literature, and eliminating RN positions, not on clinical grounds, but simply on cost-cutting measures to balance their budgets. They say that patient care will not be affected, but we know nurses will be providing care to more patients, and we know services are not accessible in the community. First, we recommend that the government fund hospitals so that they can meet the current costs and direct the LHINs and the hospitals to protect RN positions of RN provision of clinical services where patient acuity is unstable and unpredictable, so our patients are provided quality care and have positive health outcomes. Second, we also recommend a policy be adopted that actively consults with nurses regarding the impacts on patient care prior to any planned nursing and clinical service reductions being contemplated or implemented. The Public Hospitals Act provides for each hospital to put in place a fiscal advisory committee and that staff nurses are represented. Hospital FACs are mandated to make recommendations to the hospital board with respect to the operation, use, and staffing of the hospital. Many hospitals are not complying with these recommendations or these requirements. We urge the government to take action to ensure that hospitals are in compliance with existing legislative requirements related to setting up FACs in every hospital, and that each FAC makes recommendations to the hospital boards regarding nurse staffing decisions. Third, we recommend that the government put in place a moratorium on any further cuts to nursing positions and patient services in small, rural, and northern hospitals. Await the results of the government's Rural and Northern Healthcare Panel report, and then complete Ontario-wide consultations. The first priority of Northumberland Hills nurses is for the government to fund hospitals and other sectors so they do not balance their budgets by eliminating nursing positions, hours of patient care they provide, and the valuable in- and outpatient services that are not available or accessible in our community. Thank you.